Okay, the old saying is beauty is in the eye of the beholder. And so I feel like beauty is from the inside out. It's how you feel. You can have a pretty face, but if your insides are ugly, it's nothing.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Ehida Akharume, lead dentist at Advanced Dental Clinic, top 50 dentist in the central MS area, and the first doctor in the entire family in 16 years of dental practice. So, Dr. Akharume, welcome and glad to have you here.
Thanks for having me.
Yeah, so let's start from the very beginning. How did you first get interested in the medical field?
Well, my mentor in high school, she kind of introduced me to dentistry. She was a cardiologist, actually.
Mm-hmm.
And so I initially thought that was the area I wanted to go into.
Mm-hmm.
But shadowing her around, I realized that I don't like to see people sick. So I knew that was not the area for me. And I was always kind of good with my hands, good with art. And she kind of picked up on that just from our conversations, just getting to know me. And so she actually introduced me into dentistry. She said, you should go see what a dentist does. Because she said, a dentist is a doctor. And I was like, yeah, I knew that. But, as a high schooler, I really didn't know a lot about dentistry. And so she was like, you should go see one. So she kind of hooked me up with another dentist in the area. And I went to shadow him, Dr. Gerald Vincent. And it was history from there.
Okay. So did you know that you want to get into the dental field kind of right off the bat, or was it a little bit more of a progression of how you decided on dental?
No, once I had that initial meeting with that dentist and I saw exactly the things he did, I knew that was kind of the area for me. Because my best friend and I said we were like 12 and we said we were going to be doctors. And so I knew I wanted to be some type of doctor to help people. And so once I got with that mentor and she kind of introduced me to that, and that's just kind of how it happened. I knew right off the bat after seeing what he did that that's what I wanted to do.
Okay. And so now you have your practice Advanced Dental Clinic. What led up to you deciding to start this practice?
Well, I practiced with a few DSOs, which is our dental service organizations, when I first got into dentistry. And they were fine. It helped me to strengthen my skills, kind of know the lane I wanted to go into. And I was actually in the process of, right before COVID, getting approved for another practice. And I met up with the owner of this practice. And we just kind of hooked up and it just went from there.
Okay.
Yeah, I just kind of wanted to have that autonomy to do the things that I wanted to do.
Got it. Okay. Now I want to start diving deeper into what you actually do for your patients. I believe you're a general dentist, but specialize more in cosmetic cases. Is that
yes,
accurate?
That is correct.
So can you kind of explain what is the difference between cosmetic cases versus a cosmetic specialist and general dentist? I think when most people think of dentists, it's like, okay, there's only one type of dentist.
Right.
Can you talk a little bit more about that?
Well, pretty much a general dentist is your general practice dentist. You're going to have some that kind of dive into all areas of dentistry because there's so many facets. You have endodontics, which is specializing in root canals. You have orthodontics, which is the braces. You have prosthodontics, which are like more advanced prosthesis with dentures, partials, perio, which is with the gums. And so a general dentist didn't specialize specifically in any of those areas, but they do practice in those areas within their practice. So it's kind of like a comprehensive potpourri of everything.
Okay. Yes. Now, when you're looking for cosmetic cases, let's talk about veneers.
Yes.
Let's start off with what is a veneer?
So this is a question I get a lot, and a lot of people are confused about. So a veneer is actually a crown, but it only covers the facial part of the tooth, which is the front that you see. When I explain to patients what veneers are, I kind of use the analogy of a press-on nail. You only put the nail on the top of the finger, right? It doesn't cover the whole finger or all the surfaces. And so when I get patients, they come in and they say, oh, I want veneers. And some of them have missing teeth, which is you're not a candidate. Some of them have habits that will prevent that from staying on. And so we have to get into those hard conversations of, you may not be a candidate for this, but we have an alternative method that's going to look exactly the same. Because when people see the Hollywood smiles, the before and afters, the big white teeth, they think automatically veneers. But in most cases, those patients probably have bridges. They probably have dentures. They probably have full coverage crowns. They just look nice. So it's all about the look. But an actual veneer is an actual crown. It just covers only partial of the tooth.
Okay. Now, when it comes to the specific type of veneers, I believe there's composite versus porcelain. What is the difference between those two?
Okay. So you asked me what a composite veneer is as compared to a porcelain. So composite is a material that we use in dentistry. Let's say, for instance, you came in and you had a cavity. We're going to possibly fill that with composite, either composite or amalgam, which is the silver filling. The composite is not as durable as porcelain, longevity wise. It's mainly a less cost, but you can kind of get the same aesthetic effect with it if you polish it enough. But it's higher risk of breakage with those and leakage.
Okay. And then for the porcelain, I guess, in what sense then, why would you use composite versus porcelain then?
Mainly cost. Like I do have patients that, they may not be able to afford the porcelain veneers. So a less expensive option would be the composite.
Okay. And when it comes down to, I guess, recovery times, when people get veneers, it's something that you can start using it right away once the anesthetic wears off, or is there anything that people have to be kind of more careful for when it comes to veneers?
It depends. Because in some cases you may have patients that need what we call a gingivectomy, which is like when you contour the gums so that it's aesthetically pleasing. And so, because some people may have gums that are not even across all their teeth. And so in some cases, before we do any prosthesis, whether it be crowns, veneers, or anything else, we have to contour that gum tissue so that it won't ruin the aesthetic of the case. So with that being said, if a patient requires a gingivectomy before they get their veneers, you may have a longer recovery time because the gums do have to heal. But if there's no need for a gingivectomy or any other bone grafts or anything like that, then it's pretty immediate. As soon as the anesthetic wears off, you can go do what you please.
Okay. Now, I want to get into another topic, implant restoration. So let's start with implants. Like implants is the ones where if you are missing a tooth, that's where the implant can come into play. Unlike the veneer that you mentioned before, the veneer is just you're putting on top of the existing tooth, but the implant is filling in a missing tooth. Is that correct?
Correct. Yes.
Okay. So then when it comes to implant restoration, what is that specific, the restoration part of it?
So, of course, you would get the implant first, which the implant represents the root of the tooth. Not a lot of people know that. So it's only like the screw part that goes into the bone, which will be in the place of where your root once was. Once that's done and you've recovered and the bone has integrated and the body has not rejected the implant, then you get the restoration. Many types of restorations. You can get just a single crown restoration if you're only missing one tooth. You can get what they call an all-on-4, which is when they'll put a series of implants in the maxilla and they'll put a full set of teeth on there. It's pretty much you use 4 to 6 implants to restore an entire arch of teeth. So it just depends on what we're missing, what we're trying to restore.
Okay. So you said the implant is more of the screw that is into the bone, but
Correct.
what is used for the actual, I guess, tooth itself?
The same material as crowns. Like we use porcelain, we use porcelain fused to metal, we use zirconia, which is like it's a porcelain look, but it has the durability of metal. And that is the material a lot of dentists are using now because you can still get that aesthetics of it, because with porcelain fused to metal, it's not just going to look as nice, but it's durable. And so back in the day, they would use a lot of porcelain fused to metal for your bruxers, people who grind their teeth a lot, have issues like that, or people who have like erosion from like bulimia, things like that erode the teeth over time. We would use that because that's going to last a little longer. Now they've came up with zirconia, which is a porcelain like finish, but it has that durability of a PFM, which is porcelain fused to metal.
Got it.
And of course, you have your gold crowns as well that you
Mm.
can get.
Okay. Now, when it comes to implants, it sounds like it's a pretty serious procedure. It's not a straightforward one necessarily. But what are some
Yeah.
things people need to be aware of when it comes to implants? Like, are there certain things they need to be aware of just anything that they need to be aware of that you'd recommend to them?
Yes, very much so. So you have to not have certain habits. If you want an implant to be successful, you cannot be a smoker.
Hmm.
You cannot have certain diseases that leave the body immunocompromised, like diabetic patients are not the best candidates. Anyone who has had any type of radiation to the jaw area, they're not the best candidates because the bone is not strong enough to hold the implant. So you have to take all those things into consideration. And also people who have habits like bruxism, when they grind their teeth a lot, that can come from so many reasons: stress, medications, things of that sort. If you're a bruxer, you can break an implant. An implant can break.
Oh,
I
wow.
have seen it.
Mm-hmm.
And so we have to be mindful of those things when we ask for these, procedures to be done, because if the doctor explains to you, like I have, I'll explain to a patient when I see their medical history, things that could happen if they're not a candidate, and they'll be upset about it. And I'll still do it in some cases, but they have to know for a patient A, this procedure may last 20 years. For you, it may only be 7 to 10, just due to the situation we're dealing with. So everything is a case by case basis. It's not a one size fits all.
Got it. Okay. Now, I'd like to go into kind of a different topic that when it comes to dentistry is the mental health and kind of the effect that social media has, specifically
Yes.
within the dental realm. Like, what have you kind of seen as far as changes in this arena?
Well, a lot of unrealistic expectations.
Hmm.
Just like I just said, dentistry is not a one size fits all situation. It's not a thing where like you go to a salon and you can pick things off of the menu. The certain things you may just not be a candidate for. And so you cannot get upset with your doctor when they tell you, hey, I know you want these veneers, but you're just not a candidate based on this, this, and this. And I have that battle a lot with patients because they're like, well, such and such got it and she did fine. Well, she may have done fine, but she's a whole different person with different habits, different medical history, and things like that. And so with the social media makes everyone think everything is just like a one size fits all, pretty much. That's the best way I can describe it.
Mm-hmm.
And it's just not the case.
Mm-hmm.
And you have a lot of what they call these veneer techs and things like that, people who are not licensed that, put up this false facade of it's so easy to do this, this is the only way, and this is the way you do it, when they have not been properly trained and things go wrong. They don't show that part of it on social media. They just show the before and after and what happens that day. Me as a practitioner, of course, I'm going to see this patient from here on out. That is my patient. If they come for their regular checkups, I'm going to see the wear on the work. I'm going to see the problems that arise. I'm going to have to deal with, fractures and things like that that happen. I'm going to deal with the change in the medical history that may affect your prosthesis. These are the things that social media doesn't stress enough, in my opinion.
Okay. And within that, as far as the unrealistic expectations, what are some common misconceptions or myths that you hear often from your patients about the treatments you provide?
First of all dentists are evil. All dentists are scammers. We're trying to take all of your money. That's the main thing. And that's kind of like the wall, the barrier we have to knock down before I can really get into real conversations with some patients about what's needed and what's necessary for treatment.
Okay.
Yeah.
And let's say that someone is looking for a dentist, a good dentist,
Yes.
but they're not quite sure where to start. What advice would you give this person to help them find that dentist who is knowledgeable, has the experience, and has their best interest at heart?
A lot of it is word of mouth. I'm going to be honest with you. First of all, make sure they actually are a dentist. So you can go on, you can look any dentist up on any ADA website. They will have their name, any history on them, any malpractice suits, all those things. That's so easy to look up if you want to find a real dentist. And like I said, in your area, just talk to people. Look at the website. Look at reviews. Some reviews can be a little, misleading. You may have a mad patient one day and they just want to leave a bad review. But the main thing is just do your homework and talk to people, because that's how you're going to get your best representation of who is good and who is not. Just word of mouth, honestly, because anybody can fudge a review, and anyone, so word of mouth.
Okay.
Just talk to people. Okay. That's how most people find me, is word of mouth.
Interesting.
I'll be honest with you.
Okay. Now, when it comes to your approach to patient care, what role do you believe creativity plays in what you do? Because I think when most people think about dentistry, creativity is probably not the first word that comes to mind. But do you believe creativity has a role in what you do?
Absolutely. I mean, to go from nothing to something is in itself. Like, I have patients that will come in for a full mouth rehab, and I'll have to visualize in my mind, what is it supposed to look like? You can have that. I've had patients with broken down teeth or no teeth at all. And we have to figure out, how do I restore this smile and have function? Because you can restore a smile and have no function. But it's kind of pointless to have a pretty smile and you can't chew and you can't speak properly. Like, these are the things that go into it. So definitely that creativity comes with having to draw a picture in your mind of, what is this person's mouth supposed to look like? And how can I do this and also make it function properly?
Okay. Now, when it comes to the future, where do you think the future of dentistry is going?
I do think definitely more technology and materials that we use. We're getting better and better every day at that. And I know the most basic thing, like getting a person numb, they've come so far as to anesthetic techniques, as far as not having to deal with that needle. We're getting closer and closer to having to where we don't have to use it anymore. And so I think, getting more advanced in those areas. Of course, just having a practice like AI. I have a lot of AI technology in my practice. I mean, I have an AI receptionist. She answers. They think she's a real person, and so they'll come in the office like, "Oh, I talked to Emma," and I'm like, "Yeah, Emma's my AI girl." And so things like that, I think we're going to see more of. Hopefully, they won't make AI dentists, but
not yet.
Because I need my job, but but things that kind of assist us into doing our jobs better. I think technology is kind of helping us, have more tools to achieve that.
Okay. And when it comes to your practice, what is the vision you have for your practice?
The vision, just to have a practice where it's comprehensive dentistry. The whole family can come and get good service, comprehensive service, not just a one-stop shop for when you want to look pretty and want to, relieve this toothache. I want it to be a place where, you come, you trust the doctor, you trust them to take care of your needs from 20 years on out. Not just, oh, I'm in because my tooth hurts. Oh, I want these veneers to go to this party next week. No, we need to have comprehensive treatment. So that's my particular vision. I do want to make you pretty, but I want to keep you pretty and keep you healthy. So oral health is important.
I like that. Okay. Well, Dr. Akharume, I do have one last question for you, but before I ask it, I do want to point people to your website at advanceddentalclinicpllc.com. Now, last question for you. What does beauty mean to you?
Okay, the old saying is, beauty is in the eye of the beholder. And so I feel like beauty is from the inside out. It's how you feel. You can have a pretty face, but if your insides are ugly, it's nothing. So I feel like that your inside should reflect the outside just as much. So beauty is peace. Beauty is self-assurance. Beauty is pride. Beauty is intelligence. And beauty is just feeling good about yourself.
Okay. Well, there you have it. Dr. Akharume sharing her expertise. So, Doctor, where can people contact you in your practice?
I'm in Ridgely, Mississippi, and you can contact our office at 601-206-1112.
Okay. Well, this is great. Thank you for coming on, and thank you for sharing your message.
Thank you so much. Thank you for having me.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.